Good morning. Welcome to the ADRC No Wrong Door webinar. We're going to give people a few minutes to make sure everyone can hear me correctly. Can I have someone send in a chat or a question to make sure that you can hear? Okay, so as I said, this is the ADRC No Wrong Door webinar. We are going to have time for questions at the very end. So if you want to track your questions, and then we will ask you to write them into us, and then we will answer them at the end. And then I also will be sending out all the questions at the via the email after the webinar. My name is Tasha Holloman, and I am the lead for this program. If you have any questions, you can give me a call or send me an email. So we are going to start the webinar. So Medicaid administrative claiming, there's been a lot of confusion on how this differs from Medicaid admin. And this is another opportunity for federal funds to be available for staff that have been assigned to the ADRC No Wrong Door program. And it is more to help people before they have reached Medicaid. So you're helping people discuss their long-term service options in their community, and Medicaid might be the best option. What is the difference? I feel like we are comparing apples and oranges. The Medicaid is more of case management and eligibility determination, while the functions performed in ADRC No Wrong Door is more of information referral and options counseling. So once again, Medicaid services is more of case management, eligibility services, and any administrative costs associated with consumers who are applying or already receiving Title 19. ADRC No Wrong Door is more of information referral and option counseling to a non-Medicaid consumer around Medicaid services or making a referral to Medicaid. Next, we are going to go on how the program works. APD will issue a contract to your agency, and as you notice, there's two honeycombs that are in a different color. That is because staff should already be performing information referral and option counseling. So this is nothing new, and they should already be documenting their time in or documenting their work in RTZ. What's going to be new is that staff will need to enter their time into RDSS on the survey days or use their 100% timekeeping. So each month or each day, the work is being performed. And then once a quarter, let me get to the right thing. Once a quarter, your agency will invoice for the total cost of the ADRC No Wrong Door cost, and we will review the invoicing later. We will then be reviewing the invoice and verifying the documentation, and APD will reimburse for the approved amount of the invoice. This program, because of the Medicaid match, does require us to verify the documentation. So that will be something new that is going to be a requirement for your agency. What staff can be assigned to ADRC No Wrong Door? If you're an employee, it is your supervisor's job to verify that you're properly funded. Any staff can be assigned to the No Wrong Door program, but they can't be already funded by a federal program. If you have an employee that is 100% or full-time, they can be funded by 40% Older American Act, 40% No Wrong Door, and 20% local times, but they can't be reimbursed more than one time for the same body of work. And another way to look at it is If the activity that you are doing is already being funded, such as Medicaid, you can't also fund it by No Wrong Door. I know it can be confusing, so if you have any questions, we are here to answer your questions. So I wanted to briefly discuss information referral and option counseling because, as we said, this already should be a body of work that is already being done in your agency, so it shouldn't be new. But INR links people who need assistance with appropriate service providers in their community. It is more of an information referral process, and it is usually more of a short-term process. Option counseling is more of an interactive decision support process that helps family understand their strengths, their needs, their preferences, and any unique circumstances that they have that is affecting their decision. Option counseling can be a benefit to people who have their own resources to pay for services. And it's important to note that option counseling can be provided over the telephone, in person. It could be at a home, at an agency, in a hospital. But the objective is that it is where the client or the consumer feels most comfortable. And the objective of the program is to allow people to live as independently as possible in the setting of their choice. INR versus option counseling. As I mentioned before, INR is more short-term, immediate needs, and it should not take as long as an option counseling call, but an INR call can be referred to an option counseling. And option counseling should be offered at points where consumers are facing choices about their long-term care options. Can your agency just provide information referral? Under this program, your agency needs to provide information referral and option counseling. That doesn't mean each phone call needs to be both information referral and option counseling, but you do need to provide both to your consumer based on what their need is. So we're going to move on to the first system, RTZ. Why do we have to have documentation for this? Basically, we need to have clear and concise documentation for us to get the Medicaid match. This is already something that you should be doing, so it should not be anything new. So to document an information referral call in RTZ, the first step is in the follow-up notes, you include a note explaining how this call qualifies for the No Wrong Door reimbursement. Oops, we lost the screen. In this call, it says, caller requested information for her neighbor regarding in-home care and transportation, discussed Medicaid eligibility requirements and alternate options. As you can see in this example, it doesn't have to be super long, but it needs to be clear and it needs to stress that Medicaid was discussed. So in step 2, at the end of the call, you choose call outcome and then you select Medicaid. There are somewhat the same steps for recording option counseling in RTZ. Step 1, in progress notes, you add a new note describing how Medicaid or Medicaid alternatives were discussed. In this example, it says client is interested in learning about different types of residential facilities. Client qualifies for Medicaid, pulled a list of facilities that accept Medicaid payments. And step 2, in progress notes, we add a new element, Medicaid, and say Medicaid alternative discussed. And if you have any questions about RTZ, I suggest or need training to get it in touch with Lacey, and she will schedule a training. And once again, why is all this documentation required? We have to have the documentation complete to be able to obtain federal match. You are expected to document 100% of the time, but on survey days, we will verify the documentation. So now we have another system, RDSS. RDSS is our random moment sampling system. It allows us to have a statistical method that helps group types of activities for each day an employee is working. It's considered reliable because it relies on the laws of probability. The sampling method can approximate the same results as would observing employee activities 100% of the time. When is RDSS? It is approximately once per month, and then what we will do is that we will average your monthly entries into a quarterly reimbursement rate. Managers are notified in advance, but staff are notified the day before of the survey. Do we have to use RDSS? No, you don't have to use RDSS. It is meant to be to help with some of the requirements, but if you find that RDSS is more work than is required, you can submit a request to participate 100% timekeeping. You do still have to use the same codes that are in RDSS, and you also need to still document time in 15-minute increments. So to get started with RDSS, the site is maintained by Multnomah Education District, and as you can see, the website to get on is www.mesd.k112.or.us. You will click on the Random Moment Sampling or the MAC Medicaid Administrative Claiming. It's usually on the left side of the screen, or sometimes it moves to the bottom. I'm not sure where it's going to be based on what internet option you are using. Once you've clicked on that, you're going to look for a survey login, and you're going to want to click on the link that says Transfer AAA-RDSS Survey Login. Once you're there, you will see that you have a first name, a last name, and an agency. You will enter in exactly how it is given to me by your supervisor. To get signed up into RDSS, each staff needs to be entered into RDS beforehand. If you wait to the end of the survey day, it'll be a delay because I have to send it to our vendor to get set up. So I need each employee's name, their position, their supervisor, and the location of where they work. I will get them added to the system, and then they can go in and add it. We also want to mention that you want to have any of the backups that could be possibly taking the survey added before the actual survey dates. And if you have any concern or questions on how to get into RDSS, please give me a call or email me. And wants to note that if I know in advance that your agency is closed, or perhaps you're having a flu epidemic, if I know beforehand that you are unable to take the survey, we can make arrangements. But if I don't hear anything and I go back and look and you have had 0 entries for a survey day, that will impact your reimbursement level on your invoice. So some of the reporting, basic reporting is done for an entire workday, broken out in a 15-minute segment. Each segment, you pick the most prominent activity of that 15 minutes. If you don't know what it is, use your professional judgment on which activity is most likely the dominant activity. And once a big note is that only ADRC No Wrong Door trained staff can take the survey. So if you are on vacation or on sick leave, your backup needs to have the same skill level that you would have. So to actually take the survey, you can see a screen. You log in and you have all the different codes that are available. You can either click on the code first and then enter the 15-minute block of time, or some people choose to log their time on a piece of paper throughout the day, and then they click on a block of time and then just enter the code, and that way it requires less entry. Oops, go back. So on the day of the survey, you can see that approved codes are 6B and 6C. But on the day of the survey, you want to record all time. So you might have some time in box 2, you might have some time in box 8, but you will only get reimbursed for 6B and 6C. Here is an example of just a sample timekeeping log. It doesn't have to be complex. We just need to have the 15-minute increments, and we need to have the same codes that is used in RDSS. So, as I mentioned, 6B and 6Cs are the approved codes for this program. It is really important to be accurate on the day of the survey. So if you have a fluke day, please give me a call, and then we can work on how to better capture your activities for 6B and 6C. So to get Medicaid requirements, we had to break out the code. So we have 6B TM, which is total match. We have 6B, which is partial match, and then you have 6BU, which is unallowed. And then you have those same codes for option counseling. We really feel like how the state of Oregon has set up the codes, you will only be using 6B total match and 6C total match. An example would be you have a 15-minute phone call and 5 minutes of it is information referral Medicaid approved, and the rest of it is non-Medicaid. Well, we have other codes that would allow you to claim that 15 minutes in the non-Medicaid portion. But this is a requirement that we had to establish for our Medicaid proposal to move forward. So to break out activity 6B, this category is really used to capture activities related to providing general program information and making referrals rather than answering specific questions about eligibility, benefit amounts, or support needs. You know, at times this can be confusing because you can assist with the application process, but you cannot process the application. But you can also help with explaining eligibility rules and processes to individuals, family members, and other representatives also that would be included in 6B. Like I've mentioned before, if you have any questions, please let us know. Other tasks that can be included in this is assistance with gathering required program information, assisting with helping the application be completed and any necessary follow-up steps, activities that assist in maintaining current benefits during the redetermination process. If you have a question, here is my email for future reference. Some other support activities are included, so you can have data entry time, clerical time, which also includes scheduling, printing, copying, initiating or replying to correspondence, and travel time. As of now, we are including travel time as approved activity, but this might change in the future. The reason is it is covered if on the day that you're going out for an option counseling call, you believe it's a potentially Medicaid consumer. If it is an option counseling call that you most likely know that the person is not Medicaid, it would not be approved time. And also covered is any time that you have spent discussing the case with a supervisor, program experts, or any outside agencies. So moving on to activity 6C, which is option counseling, they have some of the same rules. You know, activities performed, they need to be performed by a person-centered counselor, so they need to have the proper training, but it will cover gathering and evaluating consumer information, discussing their long-term care options, providing and reviewing any written information, supporting them, develop and recording action plans. Are clerical tasks reimbursed for option counseling? Yes, they are. Some clerical tasks could be paperwork, consultation, arranging transportation if it's Medicaid related, reciprocal communication between any interested parties. So those are the codes for 6B, 6C. And we have all the other RDS codes. Type B, AAAs will have more options since they're doing Medicaid, but there's 22 codes. I'm just going to briefly go through each page because they're kind of self-explanatory. Number 4 is Older American Act, so if it has any activities related to that, you would pick number 4. OPI is number 3. You have county funded, number 5. Some more RDS codes. 9 is Medicaid. 11 is SNAP. Some more codes. You can see how some of them have repeated, and that is there's more descriptions available, and I am putting the codes and the descriptions and the title in the guides that I will be sending out for this program. So if there's any questions, please look at the guide and you should be able to see that. And there is also time for leave time, training, and general administration. This general administration would not be related to this program. It might be example of administration would be doing your time card or doing something that's non-program related. There is some additional RDS training located on the Multnomah Education Service District website, and you can see it's a training manual and some training questions. RDSS is really like an online timesheet. You literally, as I said, just go in, you record your time. But if you have any questions, you can look in the manual or you can always email me. So what do I do if an employee is sick on the survey day? If an employee is sick or on vacation, like I mentioned before, their backup has to be already located in RDSS, and they need to be trained with the same skills of an employee who is taking the survey. So if you have someone that's just taking the survey but is not performing the duties, that person would not qualify for the survey. There we go. Now we're having computer glitches. So invoicing. We are invoicing once a quarter. So July through September, October through December. We are using one invoice that, and then starting in January, we are going to be having another invoice that we are going to be discussing for the remaining of the webinar. So January through March is the first quarter of the new invoice, and then April through June is the second invoice. So how do we invoice? And so how we are going to invoice is that, as you can see on this, you have your name, your contract number, and then you have total cost. We're going to be breaking up each section, so I won't go too much. And then you see the ADRC No Wrong Door Medicaid minutes. That is going to be a percentage based on the entry into RDSS. So that's why I keep on saying entry into RDSS or on your time cards is really important, because it will directly impact how you get paid for this invoice. And then, as you can see, your cost will be reimbursed based on total costs times your reimbursement percentage and then your eligible cost. So we're going to break it out. What can you include in total cost? Well, you can include salaries of the employee, the salaries of any supervisor, for the time spent with that employee on that time, their benefits, supplies, any rent, utilities, telephone, and also if your agency has indirect rate already established, you can put that rate into that line. And then that will calculate your total cost. Now, since we're doing a quarterly invoice, you want to do, it says monthly site expenditures, but it should be quarterly. So you want to put in your quarterly costs. So the first invoice will be from January to March. So if you don't have an indirect cost rate, you can put any other costs that you feel like should be included that it's not listed as a direct cost. If you have any questions, like I said, give me a call. So once we have total costs, we now can look at what your reimbursement methodology will be. So how that is determined is that you go in and each employee will enter in their time. I will take all the employees and then I will take it and add it up, and then I will see how many minutes do you have recorded in 6B and 6C in comparison to total minutes, and that will be your reimbursement percentage. So in this example, a staff has entered 300 minutes in 6B and 6C on 8/15. On 9/19, they entered 300 minutes, and then on 9/27 is 270 minutes. This looks a little bit different than the actual screens from RDSS because I take the time that is entered into RDSS and I put it into this formula sheet that gives me the percentage of what's been allowed and what is not allowed. So in this example, the quarterly reimbursement would be 10.65%. And I get that simply by doing the 300 minutes, and then I see how much of those minutes, how many of those minutes qualify for allowed for that day. And then we have 10.36 for 8/15. On 9/19, we have 13.33, and then 9/27, we have 8.26. So that's where we're getting the 10.65. So in this example, they have said their total cost for this quarter is $25,000. Well, I can see that they've entered 16,000 minutes for 6B and 6C, but their total minutes were 150,000, which gives them the 10.67 eligibility. So if we take the 25,000 times the 10.67, their reimbursement rate would be the $2,666.67, and that would be a 50-50 split once we get federal match. You can claim more GF, but if you have to use more GF, that limits the amount of federal fund match you are eligible to claim. So how do they all work together? RDSS it allows us to calculate a reimbursement methodology. RTZ allows us to document and support our reimbursement methodology. And the invoice, it allows us to reimburse the AAAs and the SEALs on actual work performed. So next section is the frequently asked questions. I'm not going to go over that because I want to save time for the questions at the end, but I would look through that just to see if there's any questions. And I do want everyone to send me questions even after this webinar so I can send the questions out, because if your agency has a question, there's a good possibility that other agencies also have that question. And then we also, for the month of January, will be having weekly phone calls Those will be on Wednesday from 10:30 to 11. And if you want to ask a question in person, we will be available to answer questions. So at this point, I'm turning it over to see, is there any questions? Excuse us 1 second. Our person that was supposed to handle the administrative function of this is out sick today, so we are trying to figure out how to use a webinar for the first time. So let me start the questions. Glad to know everyone can hear me. I will send out a copy of the PowerPoint, and I think it was sent out previously. A question will be, when will we hear if CMS has approved the state's match activity plan? We have not submitted it to CMS. We have been actively working with OHA, which is our Medicaid agency, and I say we're about 98% of the way to get matched. So we are just waiting to officially get the word from Mike. So I'm hoping in the next couple weeks we will definitely know, and we are hoping to be able to do match in starting at the January invoice, but we do not have official word yet. Another question is, are we only receiving ADRC funds if they're matched with Medicaid funds? So if we spend 20 hours on an ADRC phone call, but none are Medicaid, then we won't get paid. You won't get paid with Medicaid match. You'll get paid with general fund dollars. So you will still get paid. It's just how you will get paid and how to explain it. So if you have a contract that's $50,000 general funds, $50,000 federal funds, if you spend $25,000 in general funds, your ability to get match is limited to $25,000. And so you just have to carefully examine when you submit your expenses how you want to be reimbursed. Okay, so the next question is, if our ADRC already completes RDS, when will we switch over to the new RDSS for no wrong door? This is a little bit confusing. I believe they still have you set up as you go in as a, if you're a type B, you go in as normal and you take the survey either as a Medicaid employee or as a no wrong door employee. That is why I've asked for a list of which employees are assigned to no wrong door so I can make sure that they're getting credit. I do think that Northwest might have a break off, but I've never received any word on which staff are officially no wrong door. The next question, the 150 minutes, that's just an estimate. It was just to show you how your reimbursement is calculated to get the 10.67% invoice percentage, I mean. So the next question, one of the slides you mentioned that staff are to document 100% of their activities on survey days. Are staff also capturing Medicaid match activities on non-survey days? Yes, you should be document 100% of your work in RTZ. Sorry, I was not clear. That is not anything new. It's just that we will be verifying that the work has been documented on the survey days. The meetings will be on Wednesday and it's from 10:30 to 11. And yes, I will make sure that everyone gets the correct information. For Medicaid match, you cannot use volunteers, and the reason is that there's no allocated costs for volunteers, so volunteers are not eligible to be used. So next question. I've been told that a person who has been counted as no wrong door cannot be paid out of Title 19 allocation at all. Is that true? It is really such a hard thing to explain, and they can be they can get the same kind of funding. The example I like to look back on is that if the activity the person is performing is already being paid by another federal funds, they can't be reimbursed by No Wrong Door. If you have any specific questions, please let me know, because I know there's been many discussions on that between the executive directors and Mike. But you just cannot, if they are 100% paid by Title 19, they would not be able to be reimbursed by No Wrong Door. Oops. And so yes, you can use match for the people if some of their salary is paid by Older American Act. They just have to have the correct percentage. So if there's any questions, please give me a call, and I can make sure that Mike is under the same understanding. So the last question is for APD. Oh, nope. Sorry, I just lost the question. So for APD, AAA offices that actually have ADRC staff complete the screening process for Medicaid request, will that be 6B or 9? It will still be 9. How to best explain it? You should be not doing anything different. It should still be the same body of work. And so if you already are doing Medicaid eligibility, those would still be doing Medicaid eligibility. Try to think of No Wrong Door as kind of pre-eligibility. And so it would be No Wrong Door helping fill out the application. But once it came to processing the application or afterwards, then it would be paid by Medicaid. For the next question, for INA and OC staff completing RDSS, do they need to remember which of their INA and OC claimants during each 15-minute segment of the day involved Title 19 discussion and recorded differently? So for example, if we talk with 8 clients over 1 hour, and 5 of those involved discussion of Title 19 and 3 did not, do we code those differently in RDSS? It would be, as of now, it would be, yes, you use your professional judgment, and you would put the percentage that you feel like is allowed, you would put that in 6B, and then you would put the other time in whatever code you feel is most appropriate. Could be Older American Act, it could be Medicaid, it could be OPI. You make the professional judgment of which placement is the best. So as of now, we don't have any more questions, but if you guys have questions that come up, you can call me on Wednesday. We'll send out the information, or you can just send me emails at any time. Well, thank you for joining us, and we hope everyone has an excellent day. Today's topic.